Okay, the next speaker is Dr. Moran Bodas from the School of Public Health about how to start a presentation.
Okay, shalom, hello everyone. I'll be presenting the work of Christian Giller, a master's student in our disaster management, emergency and disaster management program, who is currently in Germany, so unable to honor us with his presence and present the work, but I'll do it on his behalf as I supervised his thesis. And what we cover in the research is how we can better, how we can do risk communication better to engage people in a more meaningful respect of guidelines and regulations during disasters such as pandemics. So we know that in pandemics, before there is a vaccination, public adherence to health regulation is crucial in order to stop the spread of disease and to mitigate the adverse consequences of disease spread. We ask people to wash their hands and maintain hygiene. We ask people to keep social, or more correctly put, physical distance between one another. And we ask people to wear masks. And all of these are designed to try and reduce the spread of contagion between one person to another. But I feel like we haven't paid enough attention to what drives the behavior, what is behind the motivation for people to engage in such behavior during times of emergencies. So we ask people to do all of these things. We tell them that they need to wash hands, and they understand the concept of hygiene quite easily when we talk about disease. We tell them to keep distance from one another. That's not as readily understandable to most people, because you do get the sense that when you're close by to a sick person, you might contract the disease. That's clear. But we also, during times of crisis, especially major crises such as COVID-19, we seek the closeness of other people. We want the comfort of being beside the people we care for. And mask wearing is probably one of the requests for behavior that is least understandable for people. It's completely new. They don't practice this on a day-to-day basis, and they're being told to do so in order to protect themselves. We were told that we should wear masks in order to protect ourselves. And the mask most of us were wearing was the surgical mask, because it was the cheapest, most readily available one. But here's a question. What is the original intent of the surgical mask? Who is it protecting from whom? It protects the other person. The original intention for the surgical mask is protect the patient, right, in the surgery operating theater, to protect the patient from the medical staff, to avoid any droplets, right? And so that's a misuse of a mask. It's not designed to protect the wearer. It has a lot of openings that allow unfiltered air to go through. But we were told that we should wear this mask in order to protect ourselves, right? And so when you couple a message with a behavior, and it creates, the atmosphere around it is an atmosphere of, I'm not being told the entire truth, I'm not exactly sure why I'm being told this, doesn't make sense, it can crumble into people's trust, and then later on into the sustainability of the request behavior. And what we found in the scientific literature when we dig deep into this was that we should probably do things different. Instead of telling people that they should wear the mask and do all of the other things to protect themselves, we should probably tell them to do that in order to protect others. Solidarity, altruism, communality, all of these things are crucial elements that us human beings practice on a day-to-day basis, because it provides us with a strong comfort against fear, death anxiety, for example, that arises when we face different adversities and crises. And so we see in the literature different evidence emerge that, for example, in the United States, the anti-mask discourse was mostly marginal, and individuals that were inclined to help others reported more of wearing the mask. Same results come up in Germany and Switzerland. And now we should ask ourselves, can we do this better? Can we risk communicate the use of masks and, generally speaking, the adherence to health guidelines in a better way? So the objective of the study was to explore the effect of the type of risk messaging, whether it was focused mostly on individual protection versus altruism-based, on the intent to comply with health regulations in the next pandemic. The study design was a cross-sectional study, intervention-based one. I'll demonstrate the interventions in a minute. Data was collected in September 2024, and the target population was the adult Hebrew speakers Israeli population from diverse socio-demographic backgrounds. The final sample comprised of more than 500 participants, of which 75% completed all rounds of data collection. The primary dependent variable was the behavioral intention, meaning the intent to comply with health regulations. And the primary independent variable was the type of risk messaging people were exposed to. One group of people was exposed to altruism-based messaging. Another group was exposed to individualistic self-protection messaging, and a control group that wasn't exposed to any risk messaging. Of note, we used an experts panel and through an e-Delphi technique to generate the text around the intervention, so to get a consensus of experts as to what text we should present participants with to really highlight the difference between those two groups. We decided to focus on a future non-existing pandemic, and we obviously hope never to meet that Zeta virus, but we called it a Zeta virus, so it is detached from COVID, even though, you know, we all have PhDs in COVID, right? We all know what COVID is, and obviously people carry this weight into the study. We cannot really control for that, but we tried to create a new scenario called the Zeta virus. And I know this is a lot of text, and I'm not expecting you to read this, but this was the storyline that people were exposed to in all three groups. All three groups were exposed to the story about the Zeta virus, a highly contagious respiratory disease that is spreading around in the population. Essentially, everything they read was one-to-one COVID-19, okay, in terms of what the pandemic was. But we called it a different name. We told people what they need to do or what is needed to be done in this time period where we still don't have vaccine. And again, it's about social distancing, mask wearing, hygiene, stay-at-home, travel restrictions. And that was the story, the background story that people were exposed to. And then, as I said, people were distributed into two groups. One group was presented with information that it was very framed around self-protection. Wear the mask to protect yourself. Wash your hands to protect yourself from contracting the disease. Stay at home because it will safeguard you and your family. Don't go out and don't travel because you will be exposing yourself to danger, right? So all of these risk messaging was very heavily focused on the individualistic aspect. The other group was exposed to an altruism-based messaging, meaning wear the mask to show other people that you care about them, right? You're wearing the mask to show that you are now not feeling well or potentially not feeling well, and you want to protect others from yourself, right? Stay at home because if you stay at home, you protect the community, you protect the, your friends, your family, your friends, and the people you live, the neighborhood, from the spread of the disease. So the difference was really in the tone and the framing of the messages that people were exposed to. We made sure that the manipulation worked before we did any statistical analysis. We had a few items assessing whether people perceived the message they were exposed to as altruistic or not, and the results showed that the people in the altruism group were actually perceiving the manipulation as such, meaning that they were perceiving the altruism aspect more so than the people in the individualism messaging group. Okay, so the results. First off, in terms of socio-demographic breakdown, there was no statistical difference between the groups, meaning that they were all comparable, right? The distribution of the participants into the different arms of the study was randomly done, and so we were able to suggest that all groups were comparable in terms of socio-demographic background. And here you see the bottom line results. So we did a repeated measure analysis to try and understand what exactly happened. I'm showing here only two of the results, the before intervention and immediately after intervention. And you can see here, in the gray line is the control group that wasn't exposed to any messaging. In the orange line is the self-protection individualism group. And in the blue group, we have the altruism-based risk messaging. And what the analysis shows is that all groups showed improvement. Statistically speaking, all groups showed improvement, even the control group showed improvement. So just listening to another story about another pandemic can generate the urge, right, to report more compliance. But the analysis also shows framing effect. The risk messaging was statistically contributing to people's report for intention to comply with health behavior. So, I think it's also very visible to see that in the altruism group, the spike or the increase is much greater than the other group. But we also saw a comparable decline in all groups at the third time point. We measured after 2 weeks' time, we went back to these people and we asked them again about the intention to comply with health regulations, and as you can see, all groups decline, right? A comparable decrease in their report. We assessed what are the other variables that are correlated with the intention to comply. So being of older age is correlated with intention to comply with health regulations. Female report more intention to comply than males. Level of education is positively associated, so the more educated you are, the more you intend to comply with the regulation. It is negatively associated with religiosity. The more religious you are, the less you intend to comply with the health regulations, and we couldn't find any association with income. We also found correlation between the intent to comply and the collectivism scale. We assess people's tendency to perceive collectivism as a trait, as something they value. Attitudes toward health guidelines, general attitudes toward health guidelines in such cases. Adherence to COVID-19 guidelines in the past, and the perception of the use of the surgical mask as altruistic. And I think that's the most important part here. The intention to comply with health regulation was positively associated with the perception of using the mask as an altruistic act. The more you feel like people are wearing the mask because they care about me, the more you are inclined to report adhering to the guidelines. And so in the linear multivariate regression analysis, the only variables that were emerging as statistically significant, as predictors of the intention to comply with health regulation, was the attitudes toward the health guidelines, past adherence to COVID-19 guidelines, and the perception of the mask use as an altruistic act. And this model was statistically significant, explaining close to 70% of the total variance, which is very unique in social sciences to get such a high level of variance explained by the specific variables introduced into the model. So, in terms of discussion, what are we seeing here? The study suggests that altruism may be a strong motivator for behavioral change in future pandemics. I'll talk about this in a second a little bit more. But it also suggests that the capacity to sustain this over time is limited. Once people get a little bit of sense of regular routine time, they go back to not caring about stuff. And there's actual theoretical model that can really explain why this happens. I know the students from our program heard enough of total management theory. I'm sorry I'm repeating this in your ears, but it's worthwhile having included here because it actually also taps into the previous presentation. So what is terror management theory in very brief? Terror management theory suggests that humans are the only species on the planet to be aware of our own demise. Right? No giraffe rounds the Serengeti thinking, ooh, this might be the last day, I should make the most out of it, right? And no koala in Australia goes, I'm such a loser, I haven't achieved anything in my life, I should strive to do more. But us humans, we have this. We have this tendency because we are aware of the fact that the trip on this globe is going to end one day, and we need to find a way to attenuate, reduce anxiety associated with death. Whenever mortality goes from subconscious to conscious, what we call mortality salience, our body, our brains, actively work to put it back down to sleep, put it back down into subconscious. We cannot sustain and retain death anxiety for long periods of time. And so this is exactly what we're seeing here. When people were exposed to the next pandemic, I was raising their mortality salience. They were driven back in time to COVID-19 and everything they experienced there, and they were willing to comply with the regulations and indicated they were willing to comply. But as soon as 2 weeks went by, their brains did the magic that it needs to do in order to bring back mortality salience down, and then when you ask them again, are you willing to comply, they're like, there's no threat, it doesn't bother me, it has nothing to do with me. So we really need to be mindful of whether the risk messaging we are doing during pandemics and before pandemics could be inducing fear. And if it is inducing fear, it might trigger mortality salience and might trigger a situation where people don't sustain behavioral change over time. A few of the study limitations, this was a cross-sectional, even though we had 3 time points, you can maybe look at it as a longitudinal, but it really is a cross-sectional study and obviously true to its time. We did use an online panel to reach the panelists, and the conclusion, the generalization of the conclusion should be done with caution. Obviously, there's desirability bias here. We see this with the control group. Even people who weren't exposed to any intervention were prone to report more behavioral change. Self-reporting, most of the tools we use were based on self-reporting, and some of the tools were created ad hoc for the context of the research in the lack of existing validated tools. But here's the bottom line that I wanna mention. Altruism works. The study here is a first evidence. Other studies from around the world provide more evidence. There's growing evidence that altruism works even in other contexts, such as climate change. People are more willing to change their behavioral into sustainable behavior that maintains global sustainability if they perceive that to be something of a communal value, something of value to others, not just themselves. Right? And we really need to change, if there's any message I'd like you to leave this presentation with, we really need to change the mindset of people are the problem, we should treat them like a herd of sheep because they're stupid, and we should tell them what to do, into people are the solution. If we tap into their inner voice and reconstruct their socio-normative behavior so that they would like to follow the behavior that we are trying to induce, it will have a better effect, and probably a sustainable one. It's a work in progress. It's not done. It's a work in progress. You really want to invest more effort into that. Having said that, I want to take the opportunity of a few of the minutes remaining here to make a comment about Professor Ben-Har mark in the beginning of this day. I feel like the cessation of the Center for Combating Pandemics is a mistake. Us, in the community of practice, we are always in this. We feel like preparedness, emergency preparedness, disaster resilience is within our bloods, and we care enough to come to this venue and listen to other presentations. But because of terror management theory, because of this inclination of human beings to put things aside, don't worry about the next adversity, focus on current problems right now, we always find ourselves in the next pandemic going, ooh, a pandemic, we never heard of a pandemic. Does it have waves? I can believe it has waves. And we reinvent the books time and time again because we feel like, it's none of our business, none of our problem right now. And there's a value in keeping the work done and in keeping the focus of people on emergencies and disasters during routine time, during when things are not bad, so that we have the mindset to deal with them once they happen. That also taps into altruism. If we care enough about other people, we will care enough to sustain the important work done by the Center for Combating Pandemics so far.
Thank you, Moran.
Just for a quick note, I would like to thank the gracious contribution of the Center for funding this project.
Most
Thank you.